Hi, I am Dr. Amit Maydeo and I am the chairman of the Institute of Gastrosciences at the Sir H.N. Reliance Foundation Hospital in Mumbai. And I am going to talk to you today on a very common and a simple topic, and that is constipation. Because constipation is a symptom, is a problem which many people of varying ages are likely to suffer from. And one needs to understand that constipation is not as simple as the terminology appears to be. Because in various people's presentation or their language, constipation meaning is likely to differ. When we talk about constipation, constipation basically means that you do not have a proper bowel movement, or you do not pass a motion or stools properly. So in some people, when they say constipation, that means they need to go multiple times to pass a stool, but they don't have a proper evacuation at any given time. Second is another type of presentation is where there are people who do not get the urge to pass a motion. That means for 2 days, 3 days at a stretch, until they take some laxative or some cathartic, they do not get an urge to pass a motion. The third meaning or presentation of constipation is where the people get an urge to pass a motion. They don't have to go multiple times, but once they go and sit on the pot, they have to wait for a long time for the stool to actually come out. So they keep on straining, but the stool just doesn't come out. This is the third presentation of constipation. And the fourth presentation of constipation is you get an urge to pass a motion, you go and sit on the pot, it does come out, but the stool is extremely hard. So therefore it gets stuck, and therefore the person or the patient has to try to use some technique to try to take the stool out. So these are various types of constipation. Now when a patient of constipation comes to us, what we do is we properly take the patient's history, and then we perform a few investigations to try to reach a conclusion as to what exactly is the cause of the constipation. Now we have to understand how stool formation occurs. See, after we eat food, that food gets digested right from the stomach. So the food gets digested right from the mouth. As we are chewing the food is getting ground, it gets mixed with salivary juice, and saliva itself contains a digestive enzyme. So one thing we have to understand, that if a person swallows food and eats the food very fast, you skip one step of digestion, and that is grinding and chewing, and therefore little bit undigested food enters your stomach, and that starts the chance or beginning of indigestion. The second is once the food enters the stomach, the food gets mixed with hydrochloric acid, and 3 to 4 hours that food remains inside the stomach, during which the hydrochloric acid which is being produced in the stomach gets mixed with the food, and the food gets pre-digested. Now this pre-digested food after 3 to 4 hours gets pushed into the small intestine. In the small intestine, which is 21 feet long, the food gets mixed with bile which is getting produced in the liver, and it gets mixed with pancreatic juice which is getting produced in the pancreas. And in the small intestine, the proteins, fats and carbohydrates of the food gets properly digested, and it gets broken down into small nutrients, digestible nutrients. And then once the digested food enters the end of the small intestine, the good parts which are there, which have got digested, gets absorbed from the lining of the small intestine, and the good parts, the nutrients, get absorbed in the bloodstream, and that blood from the intestine goes towards the heart, through the liver after filtration, and then through the lung after purification, and then from the heart the entire purified blood which contains all the nutrients, it gets circulated throughout the body. Now after the food is digested, what remains is liquidy, but it doesn't contain nutrients. That gets pushed into the large intestine. Now in the large intestine, it has got two functions. Number one, the water content of that stool matter gets absorbed, and the stool starts becoming little bit semi-solid to solid. Then all the stool matter or the waste matter goes and gets accumulated at the lowermost part of the large intestine, and once that accumulation of the waste matter happens to some extent, then the human being gets an urge of evacuating. So that usually happens after 24 hours. So next day morning, once the waste matter is accumulated in the large intestine, the human being gets an urge to pass a motion. You go and sit on the pot, and that is the time that entire waste matter which is accumulated gets thrown out of the body. Now in this process, number one, if the type of food that you eat is not proper, then what happens is sufficient amount of waste matter does not form. Number 2, if your digestion process is not proper, then the digestion doesn't happen properly. So the content which reaches the large intestine is of a varying consistency, and therefore the stool consistency differs. Number 3, after the digestion is proper, once the waste matter is there in the large intestine, if the large intestinal movement is not proper, then that waste matter does not come out in one single stroke. So you understand this, we have to analyze the problem very carefully. So we ask the patient whether they eat the food properly, what is the type of food they eat, whether it contains sufficient amount of fiber, whether the patient is chewing the food well. Now that gives us an idea as to what should be the treatment. The next question we ask the patient is, what is the type of constipation they have? Whether they have to go multiple times or they don't get urge at all, they get an urge but they have to sit on the pot for a long time. And depending upon the type of constipation which the patient has, we usually analyze the problem, come to a conclusion, and accordingly we either do some investigations or we give treatment. For example, if the patient is going again and again to pass a motion but not having a proper evacuation, what is important is to reduce or calm down the movement of the intestine and improve the digestion of the patient by giving some digestive enzymes. With this, usually the constipation gets relieved. Second, if the patient is having very hard stools, which is very difficult to evacuate, then all that we do is to modify the diet of this patient by which the stools become soft, or we add some stool softener to the treatment plan. However, if you have a patient who does not getting an urge at all, that means what is happening is the colon is not contracting. Then these are the patients who require certain medicines to stimulate the colon. So we give medicines to stimulate the colon, by which the colon gets a stimulus and the colon starts contracting, and then the patient starts passing stool. Only rarely it so happens that constipation requires invasive investigations like a colonoscopy. And if we feel that we need to make sure the colonic lining is proper, then we call the patient after giving a proper preparation, and then with a telescope we look inside the entire large intestine, make sure that the lining is proper, and then start the treatment. So constipation, even though it is a very common problem, the symptom or the presentation of the patient needs to be completely and properly analyzed, and only if the constipation is analyzed we can usually give a directed treatment. And this is exactly what we do here at the Institute of Gastrosciences at the Reliance Foundation Hospital. Thank you for listening.